Welcome to Pancreatic Cancer Warriors. I'm Dr. James, and today we're rediving into a critical topic that could save lives. Where does pancreatic cancer pain usually start? Imagine a dull ache deep within your upper abdomen, just below your breastbone. It's not a sharp, stabbing sensation, but rather a persistent discomfort that feels as if it's originating from behind your stomach. This is often the first whisper of pancreatic cancer, a subtle signal that's easy to dismiss but crucial to recognize. What sets this pain apart is its unique, belt-like radiation. As the discomfort intensifies, it doesn't stay confined to your abdomen. Instead, it travels, boring through to your mid-back like a relentless drill. Patients often describe it as if an invisible belt is tightening around their torso, squeezing both front and back simultaneously. This radiating quality is a major red flag that distinguishes pancreatic cancer pain from more common abdominal discomforts. But why does this happen? The answer lies in the anatomy of your body. Your pancreas, a vital organ responsible for producing digestive enzymes and hormones, sits snugly in front of your spine. When a tumor begins to grow in this gland, it doesn't just affect the pancreas itself. It can press against, inflame, or even invade the rich network of nerves known as the celiac plexus that sits behind it. This intrusion on the nervous system is what causes that deep-seated pain to be perceived, both in the front of your body and radiating through to your back. What's particularly insidious about this pain is how it can worsen in certain situations. Many patients find that lying flat on their back intensifies the discomfort, making restful sleep a challenge. Even more telling is how the pain often flares up after eating, especially following a large or fatty meal. This isn't a coincidence. When you eat, your pancreas springs into action, producing digestive enzymes to break down your food. In a healthy pancreas, this is a normal, pain-free process. But when a tumor is present, this increased activity puts pressure on the growth and the surrounding inflamed nerves, amplifying the pain signal. It's crucial to understand how this pain differs from other, more common types of abdominal and back discomfort. Unlike the sharp, localized pain of an ulcer that might have you doubled over, pancreatic cancer pain is often described as a constant, gnawing presence. It's not the same as the lower right abdominal pain that might signal appendicitis, nor does it typically come and go like the cramps associated with irritable bowel syndrome. The persistent, deep nature of the pain, combined with its unique radiating pattern, sets it apart from the everyday aches and pains we might be tempted to brush off. Now, I want to be clear. Back pain is incredibly common, and the vast majority of people experiencing it are not dealing with pancreatic cancer. However, when you encounter a new, persistent, deep back pain that's combined with upper abdominal discomfort, especially if it worsens after eating or during the night, it's time to pay attention. This constellation of symptoms forms a pattern that demands immediate medical evaluation. The urgency here cannot be overstated. Pancreatic cancer is often diagnosed in its later stages, because its early symptoms can be subtle or mistaken for less serious conditions. By recognizing this specific pain pattern early, you give yourself the best chance at early detection and treatment. It's not about panicking over every twinge or ache, but rather about being attuned to your body and recognizing when a pattern of discomfort doesn't fit the usual mold. Let's take a moment to visualize this. Imagine a glowing area in your upper abdomen, just below your rib cage. Now picture that glow extending around to your mid-back, forming a band of discomfort. This is the signature pain pattern we're talking about. It's not a fleeting sensation, but a persistent presence that demands your attention. As we discuss this, it's natural to feel a sense of concern. Knowledge is power, but it can also be frightening. Remember, the goal here isn't to induce panic, but to empower you with information that could potentially save your life. By understanding what to look out for, you become an active participant in your health, capable of recognizing warning signs and seeking help when it matters most. It's also worth noting that while this pain pattern is a significant indicator, it's not the only symptom of pancreatic cancer. Unexplained weight loss, jaundice, yellowing of the skin and eyes, and changes in stool color or consistency can also be warning signs. However, the specific pain we've described today is often one of the earliest and most overlooked symptoms. As we wrap up, I want to emphasize a critical point. If you're experiencing this type of pain, don't wait. Don't try to tough it out or assume it will pass on its own. The sooner you bring these symptoms to the attention of a healthcare professional, the better your chances of catching any potential issues early. Remember, It's not just about the presence of pain, but about recognizing the pattern, the location, the radiation, and how it responds to things like eating or changes in position. Knowing your body's signals can save your life. This isn't about living in fear of every ache and pain, but about being informed and proactive about your health. The human body is remarkably good at sending us signals when something isn't right. Our job is to listen and act when those signals are persistent or unusual. At Pancreatic Cancer Warriors, our mission is to arm you with knowledge and encourage early detection. By understanding where pancreatic cancer pain usually starts and how it behaves, you're taking a crucial step in protecting your health. Remember, this deep-seated radiating pain from the upper abdomen to the mid-back, especially when it worsens after eating or when lying down, is not something to ignore. In closing, I urge you to stay vigilant, but not anxious. Be aware of your body's signals, and don't hesitate to seek medical attention if you experience the symptoms we've discussed today. Early detection can make all the difference. Thank you for joining me in this important discussion. Stay informed, stay healthy, and remember, you are your own best advocate when it comes to your health.